Would you believe people are paying a fortune for filler behind their ears, hoping for a lift that only surgery can really give? I'm Dr. Kate D., founder and medical director of Glow Medi Spa, and this is Med Spa Confidential, where we expose the risks, the red flags, and the outright illegal practices happening inside med spas right now, because you deserve to know what's actually going in your body before you say yes. Today, I'm talking with Dr. Scott Miller, a board-certified plastic surgeon in San Diego and author of Authentic Beauty. He's built his name on conservative, natural results, which makes him the right person to separate the smart trends from the risky ones. You'll find out what aesthetic drift is and why it creeps up on you. You'll also learn why Sculptra isn't a filler the way most people assume it is. And you'll walk away knowing why the newest treatment is rarely the safest bet. Stay until the end, because that's where he maps out what a healthy 45-year-old should do next. And the smartest first move isn't a needle or a laser. So, Dr. Miller, thank you so much for joining me today. I appreciate your being here.
I'm excited to be here and looking forward to a great conversation.
Yeah, so can you kind of tell our audience like what your approach is generally? What does it mean to you to have a natural look, or what kinds of approaches are you using with your patients?
So I think that we can try to turn everything into math equations, as people have done, and now entering those math equations into AI. But at the end of the day, there's that human element and retaining our ability to discern what beauty is. And that might be, as they say, in the eye of the beholder. But I think there's certain basics of balance and proportion. And I think some of us in this field and some of the patients who pay a lot of attention to this field sometimes need to be brought back to what's natural and normal, or we can create kind of a in the bubble aesthetic that starts to make everyone look the same and not striking for the wrong reasons.
Right. So I think there's this concept of aesthetic drift, right? Where let's say you get your lips done and they're bigger and you get used to that. And in only a few months, they're still the same size, but you think, oh, I want them bigger. And that new big size looks normal to you now. And you think, so have you seen that a lot with patients? Just kind of this drift of what normal looks like?
Exactly. And we've seen that in every body part from the head to the toe. You're absolutely right. But it happens with patients, but it happens with practices and surgeons too. So you really have to be aware of it and alert to it in order to avoid problems from it. So yeah, absolutely. It's kind of like hedonistic adaptation, right? You know, you wanted to be in Hawaii and then it would be great to be on a mountain. And then it would be great if you just had a nice cocktail, and you get used to a little more and a little more until you forget what's normal. So we've seen that with breast size, lip size, and on and on.
Have you noticed, I think there's kind of a geographic big variance with that too. Like I'm in the Pacific Northwest, you're in San Diego. I know around here, people really want to look themselves, natural, not too unusual looking. But I've noticed that, if you look at some of the injectors anyway on Instagram, the ones kind of in LA, Florida, maybe the Southeast of America, it's very, very different looking. I'm trying to be diplomatic here, but really,
it's I'm bartender drinking their own cocktail.
Yeah. So I notice right away, the things I look for are, what does the provider look like? So what does a doctor look like, or the nurse practitioner, whoever who's doing it? And then what does their staff look like? Because usually the staff's been treated by the person in charge. And so one of the first things I noticed about your website is everybody looks, like pretty normal and beautiful. Do you think you can tell from someone's website or their social media or any of that?
I do. Let's be honest. I think you should be careful looking at their gallery and their post-op pictures before and after, because I do think our job is to listen to patients and what patients want and what they're trying to achieve. And I'm not going to blame somebody for achieving a result for a patient that's the result that they desired. I do think that there's certain areas that should be out of bounds. It's a bell-shaped curve. You don't have to be right in the middle. You could be, a little to the right, a little to the left. When it starts to get to the extremes and it offends your artistic sensibilities as a provider, that's when you should pull the plug. And maybe there's somebody better for them. And I'm sure they'll find somebody who will do it for them. You and I both know.
Absolutely.
But I think you need to be true to your aesthetic within a certain range. But to your question, when you look at themselves and their staff, absolutely, because if they're okay representing themselves forward in a certain way, particularly when it comes to pictures they can choose as and the presentation, that's going to tell you a lot, not only about who they are, but equally as important, who they aspire to be. Because if they aspire to be something in a different direction than where you want to go, then you can be darn sure they are something in a different direction, and they're probably going to put you in a place that you don't want to be.
Right. So I saw that your place offers non-invasive cosmetic treatments alongside a whole host of different plastic surgery options for patients. So I'm kind of curious, when do you recommend non-invasive things? Is it an age thing? Is it just, where they are in their process of aging? And do you treat those non-invasive things as something to stave off surgery or something to prep your skin for surgery? Like, how do you feel that those things play a role?
Our practice, we're a very boutique practice and kind of streamlined. And I really try hard to kind of stay in my lane. And I think you have a lane of knowledge and expertise, but you also have a lane of experience. So I think if you do things all the time, you get better and better at them. If you don't, you don't. So I try really hard, and I have no interest in being a jack of all trades. And the things we offer in our office, for years I was just doing surgery. I had a broad knowledge. I did research with the Laser Institute and had a broad knowledge of these other fields. I've incorporated them into the office to the extent that they complement what we do and they enhance and prolong what we do. And patients want it to be treated here and have that comfort level. I have a slew of resources available to me that I encourage patients to use to get other treatments we don't offer, and even maybe some of the things we do offer when it seems like they'll be better served there. So we really try to be a clinic without walls and use all the resources in our community. But there are a few things, as you noted, that we've brought into the office because they complement what we do, or they stave people over until they're ready. And it keeps you from doing or being tempted to, or having patients demand to do things that aren't in their best interest, timing wise.
Right. So I noticed that we do overlap quite a bit in the things we do. So I'm curious, do you have a protocol that you do post, say, a facelift or face and neck lift of those non-invasive things to preserve what they've done? Or do you ever incorporate like the CO2 laser into your protocol for a facelift? Like, how do you position those things?
So when I'll present to a patient, first of all, obviously everything is customized and personalized. So when I see a patient, I'm assessing them from the outside to the inside, truly to the inside, to see if they're a good candidate for surgery, if they're going to be happy with the results. And then we're all the tissue layers. I think people have this mentality, like, for example, lasers you mentioned, that like lasers and facelifts are two sides of the same coin, alternatives. And they're really complementary things that are completely different in what they're accomplishing. One is improving the texture, contour, color, and whatnot, and fine lines and collagen content of the skin. And the other is releasing and redraping, repositioning, reshaping the face. So those are the things that are really complementary. Now, I do think it's important to prioritize. So if you look at somebody and their main thing is skin quality, then they should address skin quality. If their main thing is contour and shape, then that's the direction we should go. And occasionally it's both, in which case I do think contouring things first, because half the skin you're going to resurface would be gone if you do a proper, deep layer support face and neck lift. Yeah, exactly. Okay. Sometimes you'd be surprised, some of these necks. So I do think that. Yeah. And also you're going to change, as you know, when you do lasers. And again, these are lasers I don't even do. I don't do full face laser resurfacing. I let other people do that. We use the laser more as a cool peel, superficial buffing over microneedling and radiofrequency and whatnot, or it's a complement to the soft wave. But if you're going to do laser resurfacing with fractional CO2, which I think is very valuable, first of all, it's a real deal. It's not a simple alternative to surgery. It's much like surgery in the recovery, as you know. And then the other thing is that you pay attention to the borders. You pay attention to the orbital rim, the jawline, the nasolabial fold. But those features can be altered and changed with surgery, when there's lifting involved, some of the skin that ends up from below the jawline ends up at the jawline, So those decisions you make with lasers, like when to directly resurface, I know this gets into the weeds, and when to feather and what strengths, all might be changed. So that's why if you're going to do both, I definitely think you should redrape, recontour, and reshape first, and then resurface.
Interesting. So I'm going to ask you about a few different treatments and how it affects, good or bad, your surgery options. So one thing that I've kind of always thought is if you're like me and you've had a whole bunch of RF microneedling and laser resurfacing. So I know you do that in your office, and
Yes.
I've done that for years. To me, that, improves not just the texture, but the strength of the skin. So, I mean, I can imagine for someone who's older and has very, very thin, friable skin, that would be harder to work with in the facelift. Whereas somebody who, has, thick, hardy, springy skin, it'd be easier. Am I right about that? Or is that just kind of silly? There's no reliable way to know if a med spa is following safety standards or cutting corners until now. The Med Spa Board certifies clinics that prove they're doing things right. Verified products, licensed staff, and actual medical oversight. It's the difference between rolling the dice with your skin and knowing exactly who's holding the needle. If you're looking for aesthetic treatments, go to medspaboard.com to find a certified spa near you. And if you already have a med spa you love and they're not certified yet, please send them our link. Med spa owners, getting certified does more than build patient trust. It should also save you a ton on your malpractice insurance. Do the right thing and go to medspaboard.com. Keep listening, keep asking questions, and stay safe out there.
I think you're right. I would say two asterisks. One is that I think those techniques are for early aging. And I think they work well in early aging. And they work really well when you've returned somebody to that place where it looks like early aging, because you've done the structural facial rejuvenation. So surgery can enhance the usefulness of a lot of the minimally invasive and non-invasive techniques that are fundamentally made or best suited for early aging. I think when you apply them to more mature aging, where more dramatic things are needed, they can be frustrating to both the patient and the provider and seem costly.
Absolutely. So, like for me, I did a whole series when I turned 50, and now I'm not quite 59. So, like, done a whole bunch of them. But yeah, I mean, I think that for me, it's maybe staving off doing a facelift kind of thing. But obviously,
you've
for
got
somebody,
a great bone structure, you've got a great jawline and neckline and those things. So that's where, look, skin quality and a little bit of, whatever, whether it be filler, resurfacing, or tightening, those can be really useful. If you had gels in a waddle, then that would be like putting drops in a bucket of water, and you really wouldn't be seeing much effect from them, which would make you very frustrated. And as you know, people could spend, a nickel poorly and $1 well. And so I think that gets people down on the whole industry when they get frustrated.
Right. I think that people talk people into the thing that they offer. And I spend a lot of time making sure people understand what it all entails. So like if somebody has a tremendous amount of laxity, no amount of, non-invasive skin tightening is going to make a big enough dent in that. And I actually did a recent podcast episode about doing those kinds of treatments on other body parts where I just talk people out of it because it's not significant enough. They're not going to be happy, So, okay. Next question though. I did see on your website, or at least I saw it missing. I didn't see Sculptra. So what's your opinion on Sculptra? Do you like it or not? And does it interfere with your facelifts?
So not a big fan. I understand and respect some people who are. I'm pretty familiar with it. I was actually in a group of KOLs, key opinion leaders, that got introduced to it early on.
Back when there were more nodules and side effects and stuff.
Exactly. Which were, in my opinion, based on the material used and literally the chemical structure and stuff, was completely predictable. And I was having it downplayed to me as those features. they were using its analogy to certain suture materials as examples of why it was safe. And then when you pointed out that those suture materials also created granulomas, then they suddenly didn't like those analogies anymore. And I personally lost faith at that time in the information I was getting about the material and the reliability with patients. And again, I approach this all from a place of this is 100% elective.
Right.
I do not think our patient base, at least certainly mine is not very tolerant of detours and issues. And that just wasn't something I thought was worth it when we have these HAs that are always expanding in their abilities, their various viscosities, their durabilities. So that's
well, now there's a
giant
giant lawsuit about Juvederm, so causing nodules.
Yeah.
So that'll be an interesting thing that just was filed. So we don't know anything more about it other than, well, anyway, we'll get into that maybe some other time. I agree with you about how Sculptra was originally introduced. It was a very low dilution and there were a lot of granulomas and nodules and complications, and they were things that weren't responsive other than to just cut them out. And then, I don't know, 10, 12 years ago, people started diluting it way, 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 way more. And so I started using it when the dilution is 10 to 12 cc's instead of 4 or 5. And I've yet to see a nodule ever in using it for many, many years. And the main thing that I like about it is that it's building collagen rather than acting as a filler that just dissolves away. So the results are way more long lasting. And the thing that I've asked surgeons about though is does that fibrosis and the collagen and we're creating purposeful scarring kind of under the skin.
Sure.
Does that interfere with a facelift? And I've gotten very different responses from all the different plastic surgeons I've asked that question to. So I'm curious to know your opinion if you've operated on people post Sculptra and has it really annoyed you?
So I want to ask you a question, but we'll come back to it. So number one, yes, I have. Number two, it has sometimes and it hasn't sometimes. I think it depends on the way it's placed and the artfulness and evenness with how it's placed. Just like tattoo removal is a lot harder when it was amateurishly put in at multiple layers of the dermis so that it becomes harder to laser that into tattoo removal. So is doing a facelift when there's a nice even plane of fibrosis. We can deal with that, even use that. But when it's uneven and clustered and not anatomically placed, then that becomes much more challenging and we end up trying to trim or at least smooth some of it out. My question for you is, if Sculptra is an inducer and not a filler, which is, I believe, how they choose to categorize themselves, then tell me why we even talk about how long it lasts. I don't understand why we talk about how long it lasts or its duration or the frequency of retreatment if it's an inducer and not a filler.
I don't. So, I mean, what I tell people is whatever collagen your body produces in response to the Sculptra, your body's going to then start to break down 1% to 2% per year, just like every other bit of collagen in your body, right?
Sure.
And so I don't actually speak about it that way at all. I just think that my patients have gotten really great results with it, usually 2 to 3 treatments, and it takes many, many months to slowly build up some collagen response. And then whatever collagen you get out of it will last for a really long time. The problem is the rest of aging keeps going. So the rest of aging, you have to do, prevent your collagen loss, number one. So whether that's, laser, RF microneedling or whatever, you want to prevent that thinning out of your skin. And then you're going to just...
I think aging is you asked why we incorporate some of these modalities into the practice. And it's because aging, it's a tide. It's like if I dropped you in the water, near a jetty, you wouldn't just stay still.
Right. No, I tell people that all the time. Like, we are not... You're still getting older and stuff is still going to happen. Yeah. And so, what are the big things you can do to preserve your skin? But it's really hard to do anything to prevent the scaffolding underneath your skin from changing. As you get older, it's all changing. So your bones are changing. You're losing those fat pads and everything. Okay, well, that gets me to fat.
But just to come back and just to put a bow on it. So again, I'm not saying Sculptra is bad, and I think it can be used well and artfully. for my practice, again, with complication avoidance, et cetera, and with the surgical tools in my armamentarium, I feel like the idea of using HA for filling with its pros, and I don't really see a lot of cons because properly placed, if they don't like it, I can dissolve it. It works and accomplishes my purposes. I'm just complication averse. And so I've tended to avoid that. But I certainly have practitioners I know, respect, and refer to who use it. And I think it certainly plays a role, especially in the more severe facial atrophy cases. But just
Yeah. I think the whole question about filler and Sculptra. So first of all, Sculptra is not a filler. So just to make sure everybody in our audience understands that, people call it a biostimulator. Okay. So
yes,
we've covered that. So interestingly though, in general on this podcast, I tend to cover problems that are out there in the industry and where people go terribly astray. And I think the number one place where people go astray is filler. And so it makes me nervous to talk about filler as though it were totally benign, because I think that everyone and their dog literally is getting filler, whether it's legal or not, and sticking in people, and it's not necessarily in the right place or done well anatomically. And I just think that people are chasing loose hanging skin with filler. And so you end up with this weird looking face, which we alluded to at the beginning of the podcast, where, people are putting so much filler in places and altering what people think of as beautiful.
the latest trend that I've seen with this, I've noticed it inadvertently. Like I'm seeing patients for consults for facelifts, and I'm noticing giant bulges behind their hairline above their ear, and behind their hairline behind their ear, or lower down just behind the angle of their mandible. And there's a trend of people trying to put very high volumes of filler, the more viscous fillers, in the temple, low temple, just above the ear and behind the jawline. And the idea they're going with, as you and I know, you can put filler in the zygomatical malar, the upper cheek area, and that can give you a nice little lift, because it's basically like putting in a cheek implant. You're augmenting the bone structure and lifting up some of that soft tissue. Well, they're seeking that from areas that are much more remote and distant from what you're trying to reshape and lift. I haven't seen it really accomplish what they're presuming to accomplish. And it creates, albeit it's kind of hidden, but it creates these really weird, when you're evaluating a patient, you're like, what in the world is this? And I figured it out. Now I've operated on a bunch of people with it, not for that, but for other reasons. But you come across it and you just get like a pool. It's like dipping into an area where there was an oil leak, and you get a pool of filler just pouring back out at you when if you cut into the capsule around it, even inadvertently.
Oh my God.
So, and I haven't seen it. I haven't seen one patient who said, yeah, that accomplished what I wanted, or yeah, that got me the improvement. And they're using a lot of filler to do it. So it's got to be costly as well.
Really expensive. That's so interesting. Okay. So one, that's new to me. So one take home message today is don't do it. If somebody recommends that, that does not sound fruitful or a good way to spend your money.
Yeah. We have a saying in plastic surgery that, like, when a knot breaks, we have a saying, it's not the suture, it's the jerk at the end. So, and I think that we have to remember, like, not all practitioners are created equal. And that's, I don't mean that as an arrogant thing. Maybe I'm not the right person for a certain patient, and vice versa. But, you need to find who's right for you, who you have confidence in, whose aesthetic agrees with you, and who has the experience that what they're saying means something. There's the influencers who aren't even doctors, nurses, estheticians, or anything else, but they can talk a good game about this stuff. They just read enough articles. The question is, who's done it over and over and over, so that they've learned which paths in the road not to take.
Yeah. I mean, I think that, like, number one, as physicians, first, do no harm. Like, we don't want to do something to make money that's going to hurt someone. That's terrible.
Yeah.
Like, it's just, so I think that's really incredibly important. Okay. So I would like to ask you about fat. So we've talked about filler and Sculptra, And the purpose of those generally is to fill where there's been volume loss, right?
Yeah.
So one of the other things that's super common, especially among plastic surgeons, is using fat allografts, right? So taking fat from somewhere in someone's body. And I've never gone through this or done it, but you obviously have to process it and make sure the fat's going to live and be supported in its new location. So my first question is do you do that, and what do you use that for, and do you find it that handy and helpful? And then I really want to ask you about a new product that's out there called AlloClay, which is fat that's used for, I think, that same purpose, but it's collected from cadavers and actually commercially available now. And I'm curious to know your opinion about all of that.
Well, so I'll take the last one first. There's a very important difference between autografts and allografts. And what the AlloClay is, an allograft. That's a graft from something else. Okay. That inherently is going to be more challenging to get taken longevity than an autograft. Okay. And that's a really big deal because that's what we're looking for. We're looking for the effect, both biological with rejuvenation of the overlying tissue, which has really not been shown in any of the allograft material, but has been suggested in some of the autograft literature. And also we're looking for take. And the reality is in autografting, which is your own tissue taken immediately, it's still live tissue, it's processed properly, filtered, put it back in a proper kind of parcel technique where it's surrounded by healthy tissue, lives by dissolving of the oxygen and nutrients around it, and then it develops its own blood supply and is alive, is your tissue, and never. It's like a skin graft on a burn patient. Okay, that the take is 1/2 to 2/3, and that's the research. And there's a variability of it, which is why I'm not high on it as a primary facial rejuvenation technique, because what if it takes 75% on one side and 25% on the other? There's a certain variability of it. 1/3 to 1/2 isn't going to live. And that's just the research. People can pretend and tell you about their special technique, but then they should keep track of it and publish it, because the scientific research out of the University of Pittsburgh and other places shows 1/2 to 2/3 lives, which is amazing, but it's not entirely reliable and predictable. But that is the biology of how autografts function and live. I think it's a really nice complement sometimes to what we do in severe cases that require it. It's really great with lumpectomies and radiation where there could be defects, asymmetrical unilateral defects, and it can not only fill in the volume deficit, but it can also rejuvenate some of the radiation damage overlying it, some of the research suggests. But when you're dealing with a symmetrical structure, or at least a structure like the face in rejuvenation that you would like to be maximally symmetrical, I think you shouldn't rely on that primarily, and it's often used. In my book, I talk about the fat of fat. In Authentic Beauty, I refer to it as the fat of fat, because it's become something that everybody has to say they do when they do a facelift, or they don't feel contemporary because they don't. But oftentimes it's supporting a deficient primary facial rejuvenation technique using the deep layer and the structural support. When you talk about allografting with the product, I think then you have to look at, okay, what's the research on allografting, and what are the other products that have come up with allografting? Seri, which was a product used for a cadaver dermal product used to support bottomed out breast implants and maybe try to prevent capsules. And it was proposed to prevent capsules, but then the research over time didn't support that. And then does it really help bottoming out? And then it didn't really. And now there's more synthetic materials that people are using to treat that. So I've just seen so much of this stuff not live up to the original hype, and then it either disappears or it finds its place in selective situations. So I'll be the first to say, I don't know where that's going to fall out in the treatment.
I don't understand.
Sorry. I don't know where that's going to fall out in the treatment algorithm, but I do know that we don't know yet. And I decided not to be on the front line of that war, because I don't want to get the first bullets and arrows.
Yeah, well, I think it is very much brand new. And the big controversy just recently was that New York State got involved and confiscated a bunch of the AlloClay product. in a kind of regulatory battle. New York State's like, no, you don't have a license to distribute that here.
Yeah.
And they're like, but wait, we don't need one. And I don't know, but that's how it made the news recently.
Well, the reason people want to go sometimes with the alloderm or allograft product is because there's so many regulations around the autograft, right? And you have to harvest it. So now there's a donor site involved, right? And you can't, I used to have patients come and they would say that the doctor liposuctioned the fat, they used some of the fat, but then they froze the rest to use later if they need more fat. And I said, well, wait a minute, because presumably cool sculpting works by freezing fat and that kills the fat. So how can it kill the fat and yet preserve the fat? So again, I think it's good to do we don't have to do every experiment on a patient. We could do thought experiments and rational experiments sometimes and eliminate certain treatment options.
So if you do an allograft, if you do an autograft and you're taking someone's own fat and only half to 2/3 survive that, what happens to the remaining third? Does it go through fat necrosis? Does it dissolve away?
Yeah.
Does it get lumpy? Like, what are the consequences of that?
Well, exactly. So if you put it in properly in a parcel technique, because the way fat grafts live is by diffusion of nutrients from surrounding tissue. So it's just like if you were planting flowers, you don't plant them too close together and all bunched up. You put good soil in between. So it's kind of a reverse liposuction technique is the way you place the fat. So if you do it that way, the fat that doesn't take just basically involutes on itself and is washed away in your lymphatic system. If, however, you put fat in like a big blob, then the fat on the inside doesn't get any blood supply while the fat on the outside can live. Then you can get fat necrosis and low granulomas and stuff like that. So it has to be done right if you're going to do it at all. And even done right, it's no longer going to survive, but that's okay from the standpoint it's not going to cause any local problematic issues. However, it's problematic if, again, you're looking at the two sides of your cheekbone, right?
It took on this side and didn't take on this side, and then you look weird.
And you know, of course, if you told me it takes half, my first thing as a patient is, well, then put in twice as much, but it might all live. You know, it's a graft.
Right. So I think where you and I are really on the same page is we're both very conservative and don't want to jump on something new when we can see obvious issues with it. It's like, why, I think it's really hard in the industry where people are constantly trying to be on the cutting edge and offer something new and do the latest and probably not greatest, right? It's the latest, but it's not greatest. And I think that
it's a shortcut. It's a shortcut to practice building. But it can be fool's gold because if it doesn't pan out, the patients that you got will not help compensate for the patients that you won't get, especially in the era we live in of social media and communication. I think that, and ironically, the patients who probably most want the latest, greatest thing they found out about on social media or in Vanity Fair, those patients are the least tolerant or likely of any bumps in the road in their healing. I'm not even talking complication. I'm talking bumps in the road. So, just take a longer time to achieve the result or process to achieve the result they want. So those, that's just not something I'm interested in producing quality results over time that leads to happy patients, that leads to happy days for me and my staff and my patients. So
absolutely. I think social media, what you can see out there is it's so bad for making everything look simpler than it is, faster than it is, better than it is, higher chance of, or perfection than is reality. Right. And people just think that's it. And so if you didn't do that, you must be no good. And, and so one of the people I've interviewed, one of the plastic surgeons I've interviewed on here has said that he actually thinks that social media has destroyed plastic surgery as an industry. He thinks that it's really done a lot of damage.
I agree with him on the last thing. I think it's done a lot of damage. I think that it takes a tremendous amount of fortitude as a practitioner. And I have the benefit of, my practice was well established when this all came to maturity. So it's even tougher for these guys and gals just starting to try to, break through and break in an era where you do that best by creating Pollyanna expectations and promoting a new technology. You also become the best friend of industry when you just say every product is great. I mean, based on what I said, I guess I won't be getting any calls from the Sculptra rep. So, be right. But I had the advantage. My practice is mature and I can sort of ride with what I've established. So I am empathetic for people early on in that process. By that same token, I think when you talk about med spas, that's even more so. Let's be honest. That's even easier. They're trying to commoditize plastic surgery. It's even easier to commoditize med spas. So for you to differentiate med spas, which look, there's still somebody at the end of that laser, at the end of that needle, and it does matter that, but yet to get somebody to be able to stand out and get noticed and get attention and get business, then there's a urge to kind of jump on all these things.
Yeah. I think the word you used earlier, KOLs or key opinion leader. So that makes me cringe. Yeah. Not that I haven't known a few who are just lovely, awesome people, but right. I just need to say straight up, like there's not ever been anyone that has ever paid me to be on this podcast ever, and will never do that. I don't care who approaches me, and I will never ever be a KOL because I'm not taking money from industry. So not me. And then also not the med spa board. Like I can't tell you how many people have encouraged me to take industry money to get the thing off the starting gate. And I'm like, no, we're 100% independent, no play to play, because I don't believe in that. And because who can you believe if some industry person or company is paying them to speak, right? So I agree
with you.
Can't stand that.
I think it's important, and that's why I wrote Authentic Beauty, because if I can't write it and say some controversial things and say some things that I believe in, then who can? Because I'm really, I'm established and I'm not dependent on them. And you're absolutely right. For a lot of people, the KOL thing is a career option. It's not. It's not an ethical passion. So that's
it's how they put their kids through college. And I'll tell you, as someone with 3 kids in college right now, I mean, I could see why it's tempting, but yeah. I mean, and you know what? So describe your book real brief, and we'll have a link to your book in the show notes if you want to just tell our audience what your book's about.
No, I appreciate that. I mean, it's basically broken down into 3 sections, is simple way to think about it. One is the Miller Manifesto, which is my rant of what I believe aesthetically, hopefully with some fun stories of patients and a lot of tools and checklists and decision aids that I think can help people along their aesthetic and or other medical journey that they may encounter. I've gotten good feedback from people who said, hey, my grandma got kidney cancer, and this helped her as she was seeking a provider and making decisions and stuff like that. So we have some general medical decision aids and checklists and stuff. So that's the first part. The second part, it presents a paradigm for how to practice that patients should look for in a practice. And then honestly, young practitioners or people starting out or setting up should maybe think about incorporating, because it's going to give you the freedom and the right incentives to create the best results for you and the patient, which is at the end of the day, they happy patients, happy days, happy life. So that's going to be the first thing. Now, you do need to structure that in a paradigm where you make a living and you don't go out of business because you don't help your patients or anybody else if that happens. So that creates that paradigm. And the third section is kind of focused more on specific procedures and kind of a patient manifesto that a patient should demand to be looking for and seek out information. I mean, I just gave a talk at the Cannell Symposium in Orange County at UC Irvine, and I got up there and I kind of popped the bubble of what the deep plane, right? We're all hearing that everywhere we go, every time. The deep plane facelift. And my thing is, is it the deep plane facelift or a deep plane facelift? There's a deep layer that we can use optimally and constructively and in a customized way for each patient to achieve their desires. But it is not one algorithmic set of maneuvers that you always do every time in every patient. But, it's more complicated to say that. It takes more time in a consult. It doesn't have a little rhyme with it. So people tend to avoid that conversation but I felt like somebody needed to pop that bubble. And I can tell you, this was a room full of like very significant surgeons from around the country, and specifically focused probably more around Southern California and Northern California, and some internationally. And everybody's just nodding along going, yeah, oh my gosh, yeah, because I didn't get any dissent on this idea that there is a deep layer to be used, but there is not a specific the deep plane facelift that is always done the same way in every patient.
Right.
And thank goodness.
Well, I think that when you speak the truth, you get a lot of nods, and maybe a lot of people in the audience are like, yeah, glad you're saying that and not me, because I don't want to take, but it's totally true. I mean, I've been that person too, right? Where I'm like speaking the truth, and like anybody who's been there, they know that, right? So, well, I appreciate that. I haven't actually read your book, so I'll take a look. I mean, I'm curious to know what made you sit down and write it. Cause I know that for me, like I wrote my book, that's Med Spa Mayhem. I couldn't not write it. I just had to get it out there. I was so like, nobody was talking about what's happening in the med spa industry, which is kind of why I have this podcast.
Right.
And I couldn't believe how no one knew, right? Now, a lot more people know now. There've been so many more news articles and frankly, arrests. There was just another arrest in Georgia last week of someone, with basically one of these illegal med spas, and they're actually being charged with multiple felonies because they're practicing medicine without a license. So I'm actually happy that things are changing now. But I'm curious to know, like, did you have something similar where you're just like, I need to talk about this and get this out because this is my philosophy and nobody seems to be espousing this kind of thing? Or how did you decide to write a book?
Exactly. I think it was that. And also the fact that, I'm doing this all day, every day, and I'm seeing people and they all have these questions, and I see the light go on when I explain the answers to their questions, or sometimes the biology or anatomy behind the answer to their question. And so I knew there was a message. There was a message that wasn't being heard, that needed to be heard. And I wanted to share that on a broader scale than just a practice, have a bigger impact. It was something I wanted to do for a long time. They say amor fati, love your fate. So I guess for a long time, I had a lot of self-loathing because I wasn't getting the job done. But now I'm kind of glad I didn't get it done right away when I first wanted to, which goes back 5-10 years, and got it done more recently because I think it comes from an even more experienced, authoritative, definitive, opinionated, insightful place. So I'm really glad that I could share it. Obviously, things will continue to evolve, but I think overall, it's just a message that I felt wasn't being heard, that needed to be heard, so that patients can at least have the option of having the best experience and the best results.
Well, awesome. So we'll have a link to that in our show notes. I wanted to ask you one other question. So just to for our audience, if you had kind of a typical 45-year-old with good skin, doesn't need any kind of surgery yet, but is totally open to it down the road if and when they need it, what would you recommend for that person over the next 20 or 25 years? What would you tell them?
I would start, and this is not to plug, but this is something in my book. I would start with, do they have a concern? Because I think that's so important. Is there something bothering them? Because that's a question I get. That's probably the most common question I get, even socially, is should I be doing this? When should I be doing this? When should I start? My friends are doing this. And so I would start with, number one, is there something that's bothering you now? If there is, I would zoom in on that. What's bothering you? What's the anatomic cause for the feature that's bothering them? Is it something that I feel is objectively there and objectively objectionable? Or is it them being really hyper self-critical? And then what's the anatomic basis behind that? And what would be kind of makes sense as a structural way to address that? If there is something and it's bothering them and you agree it's objectionable, then the question is there a minimally invasive way, a non-invasive way, or is surgical? If it's surgical, does it make sense now, or is that really overkill? If it's not something I see, then I would talk to them about that. If it's not something that's bothering them right now, then I would say you don't do corrective procedures for things that aren't bothering you. what you can do, as you alluded to, is do some of these non-invasive things that keep up with the tide, so that maybe you can put stuff off for 3, 5, 10 more years than you would otherwise. That's perfectly reasonable. And the best way to do that overall is by thickening your dermis, right? Not that, you get a bunch of people walking around going, I want to thicken my dermis. Sounds silly, but that's, if your dermis is thicker, you look like you have less wrinkles, your skin is more vibrant. I always tell people, with skincare, cleanse, correct, hydrate, protect, cleanse your skin. If you're not getting, and that includes exfoliation, and if you're not using a facial scrub intermittently or some kind of chemical exfoliation, you're walking around with dead skin over your live skin, you're not going to look your best. Why would you worry about having procedures or injections when you're not even putting your best face forward, no pun intended? Then you want to, then jumping to the hydration and protection. Those are easy things to do, and those are sensible things to do. And again, if you're not going to protect your skin against ongoing damage, then why worry about treating previous damage and hydrating it with, not with a, cake frosting that just sits on top of your skin, but something that actually gets into your skin, hyaluronic acid based, and permeates. And then you look at correction things, whether those correction things are lotions and potions, or soft wave and microneedling, or surgery stuff, right? Up from lasers and peels up to real surgery. So you look at those, but it's a ladder, and you look at where you need to be in the ladder. It doesn't mean you do early steps in the ladder if you know you're going to need the higher steps, but it does mean use the simplest thing possible to address what concerns you.
That's great advice. And if anyone in the audience is interested in kind of a deep dive on everything that he just said, the July 30th episode is kind of a full consult that we did to talk about all those things. So that if you're interested in that, go back and listen to that episode. Well, Dr. Miller, that was so great. It was so great to hear from you on all these things, and I appreciate your wisdom. I think that in general, if somebody's looking for a plastic surgeon, they really should go to somebody with your kind of experience and perspective and conservative approach, because I think that putting out all these, super duper latest thing that hasn't been tested is really difficult and problematic. And if someone's pushing those things before they've even been tested, it's hard to know that that's going to be safe.
I agree. And I think people get sometimes sold like this false choice between being undercorrected or overdone. And there is a Goldilocks happy place in the middle and it's technique related. So you got to make sure that your surgeon is based in foundational principles, but up in contemporary techniques, so that they can give you a result that's real, balanced, natural, and lasting.
Well, hey, thanks so much for being on the podcast today. And we'll have all your contact stuff and information about Dr. Miller in the show notes if you want to reach out to him. So thank you so much for being on the show today.
I appreciate it. It was a fun conversation and fun to kind of bump up against some of these thornier topics in our field. I think we stepped into some quicksand here and there, but we made it out, and hopefully people are better off for it.
Thanks for listening. If this episode opened your eyes to something you didn't know before, share it with someone who needs to hear it. Subscribe so you don't miss the next one. And drop a comment telling me your biggest takeaway. I actually read them all. Join me on this mission to keep you safe and push this industry to do better.